Welcome to the new lecture on integumentary system. Learning basically all things on pathophysiology, anatomy, and diseases is not at all important for Nclex examination. Your focus should better be towards realizing the nursing intervention and patient care. So, as a nurse attendant, you may have worked with various cases of handling the patients with pressure ulcers. So what is pressure ulcer? Any damage to normal skin integrity due to pressures from underlying bones or frictional pressure from external surface which can restrict the blood flow and cause necrosis and ulcers. Pressure ulcer is a very dangerous condition. It is for this reason the position of patients who remain lying in the bed is constantly changed. There are basically 4 stages of pressure ulcers. In stage 1 there is red intact skin with no wounds. Note that this area does not turn white when pressed. This is a sign that a pressure ulcer may be forming. The skin may be warm or cool, firm or soft. In stage 2, some abrasion and visibility of subcutaneous skin. There is the formation of open sore. In stage 3, dermis part is lost and forms a sunken hole which is also called crater. You can see pink area and body fat with some serums and blisters. In stage 4, full skin is lost and there is opening of underlying muscles, tendons, or bones. There could be damage to these underlying tissue too in this condition, so this is a very serious situation. Sometimes the development of pressure ulcers doesn't go in visible and distinguishable stages. There are 2 more such kinds of pressure ulcers. First is unstageable, in which the core or crater is totally covered by dead skin, so you cannot tell how deep is the sore. In deep tissue injury, usually, the pressure ulcer is not developed on the surface, but in deep tissue due to friction with bones and damage to internal areas. The area may become dark at first, but can quickly develop to stage 3 or 4 tight pressure sore. Nursing management of pressure ulcer. So more than the theory part, more important topic for Nclex would be to learn how to manage the pressure ulcers. The dressing would be slightly different for each type of ulcer, but nevertheless, the procedure or nursing management would be the same. You should identify the patients who are at high risk of developing pressure ulcers. Immobile patients, old patients, and patient with acute injury with accidents are at high risk. You should reposition the immobile patients every 2 hours or less. We should also develop a plan for skin care. For a stage 1 sore, you can wash the area gently with mild soap and water. Stage 2 pressure sores should be cleaned with salt water or saline and rinsed to remove loose, dead tissue. Keep the sore covered with a special dressing. Different types of dressings can be applied to different types of pressure ulcers. For management of type 1 pressure ulcers, apply non-transparent hydrocolloid dressing. The hydrocolloid dressing is painless in removal and is waterproof. You should clean the affected part every day. For type 2 ulcers, apply composite film hydrocolloid dressing and hydrogels. The hydrogels can stop the growth of bacteria around the affected part. You should clean the affected part every day and necrotic case every 6 to 8 hours. For type 3 pressure ulcers, the dressing is hydrocolloid hydrogel covered with foam dressing gauze. The advantage of the foam is it conforms even to uneven wound surface. In this type of ulcer, the sore is deep, so the area may be difficult to clean frequently. You should, however, at least clean or change the dressing gauze at least once a week. For type 4 pressure ulcers, you can additionally apply calcium alginate gauze on the affected part. Alginate is basically used as packing material for deep wounds. It helps in the development of scar tissue along with the protection of the underlying parts. The dressing should be changed 2 times a week. For unstageable and sometimes for deep tissue injury, surgical interventions may be needed along with adherent film gauze. Let's take another quiz. A nurse reads the patient profile that he has stage 4 pressure ulcer on the thighs. Which finding would the nurse expect to note? Your options are: Option 1, the dermis is lost. Option 2, the internal organs, tendons, and muscles are visible. Option 3, the skin is intact. Option 4, pinkish skin with blisters. I will give you some time to guess the answer. Okay, let me reveal the answer to you. The correct answer to this question is option number 2. In pressure ulcers of stage 4, full skin is lost opening underlying muscles, tendons, or bones. There could be damage to these underlying tissue too in this condition, so this is a very serious situation. I hope you got the answer right.